if you look at the CHW data, we knew January for Rachel was going, Rachel's our community health worker here. We knew that was gonna be downtime for her, just the holidays and everything else, but she's rebounded very nicely. In February, she brought on 4 new clients, closed 4 cases, which is encouraging because being able to close out a case means whatever they came in to help, she did. So that's very encouraging for us. I know yesterday she had 3 new clients, so those numbers will look way better next month. I think that's all I got unless people have a question.
Alex, are you, so I've talked to you about this before, I know you're doing that your department's doing the anti-vaping. Are you hitting a couple schools in St. Joseph County?
Josh has done, I think he did 1 in most of them are in Branch. He has done a couple there. To be honest, we didn't push hard for that presentation. 1, because we really didn't have the funding to be doing it. 2, we weren't sure how it was going to be received. But now that we know all of that, we are open to. We're hoping to, parlay that into different schools, and anywhere that it's needed. I mean, not only the opioid, funding, but anti-vaping is huge in all the schools, and they don't necessarily have someone that comes in and his presentation. It's not a don't vape. It's a presentation about here's what happens when you vape. It's informative. It uses facts instead of him just standing up there and
Who's a good, so would a good contact for you guys be the superintendent of the school? Or
Yeah, absolutely.
If I could get you in contact with a couple of superintendents and
Oh yeah, absolutely, yeah.
Okay, well I can send those on to Becky and I can reach out. I know Three Rivers I think would be appreciative of that, so I can reach out to Nikki Nash.
Yeah, I don't know of a school that wouldn't be,
Yeah.
with dealing with the vaping issues that they are, that wouldn't be receptive.
Yeah, and he's done it in different. He did it for the Sturgis football team, I think. So he's done it in different capacities, and they've all been very well received. That being said, we want to parlay that into him doing more of these on different topics that we have obviously have funding for. That's important. But yeah.
It sounds like it'd be best to get maybe Becky the information and maybe, and if you have contact, like I can contact Nikki Nash and then pass that on to Becky, and then she'll at least know that we're contacting her and setting up an,
You can reach out to superintendents, but I think that personal touch. So Jared has kids at Three River schools, and that always, that makes a difference when a parent in the school district and an elected leader reaches out and says, hey, there's this program and I think you ought to take a look at it. So if you have those connections, they certainly help.
Do you have to have like an outline of the program or something we could give to them?
It is actually posted on our website, but do we have an outline also?
We do not have an outline. We can create one.
Some bullet points we could hand to them and just be like, here, this is what we're offering.
Right, yeah. Absolutely, we can come up with that.
Any other questions for Alan? Thank you.
Thank you.
We'll see you back up here in a minute, maybe. Moving forward, financial report.
So, good morning.
Ms.
You
Fisher.
have before you the bills for February totaling $324,849.40. I would be happy to answer any questions you have about this.
We need a motion to accept the bills for the month of February. Make a motion to accept the bills as presented for the month of February.
support.
Motion by Commissioner Baker, supported by Commissioner Hoffmeister to accept the bills from February. Any additional questions? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries.
All right.
Financial statements.
Moving along, you have the balance sheet in front of you and your expense by program. As always, we continue to monitor our budget and see where our expenses are lining up with what we have budgeted. And I'm happy to let you know that we are 5.75% under budget right now. That won't look so good if some of these other, things go through here later in the meeting, because we're about to spend, some money. But the programs that are currently over budget, based on what we have budgeted at our amendment number 1, is RU10, and that is a revenue issue, not necessarily an expense problem. And then 325, which is actually not really over, because it has to be combined with 112 together. 325 has to be totally expended before 112 kicks in. So that's actually, when looking at them together, that budget is a little bit under. And then RU32 is a 9-month budget, so it's actually under as well. RU008 is over budget. It's generally over budget at this time of the year, because we do an annual sick time payout at the end of the year, and that will fall back into line as we move through the year. And then RU115 is slightly over due to one-time expenditure. We get some incentives that we hand out to folks, and those incentives have all been purchased. And then RU12 is still slightly over budget as we move through bringing our folks into compliance with their contracts. Happy to answer any questions you may have.
Any questions on the balance sheet and financial statements? If not, I will entertain a motion to accept those for the month of February.
So moved.
Motion by Commissioner Hoffmaster, second by Commissioner Matthew to accept the balance sheet and financial statements for the month end of February 2023. Any further discussion?
I have one comment I would like to make. You had an audit presentation, and I just wanted to let you know that the finance team here works really hard to make sure that we get clean audits. And, I'm really proud of my team, and they've done a really terrific job at keeping us in line and making sure that we have clean audits and produce good financials and keep us moving in the direction that we need to be moving.
Thank you.
Agreed, 100%.
Motion on the floor to accept the February financial statements. All those in favor say aye.
Aye.
All opposed, motion carries. Committee reports. Commissioner Hoffmaster, do you have a report from the Finance Committee?
Do we have minutes? Probably not.
Not yet.
We literally just had it, so yes, we'll have meeting minutes in the next month's, Board of Health. But most of it's on the new business, so we'll get through it.
I can give you a quick recap from my notes if you would like.
Perfect, thank you, Tracy.
So in the new business, under the EH fee schedule, the Finance Committee recommended that the full board approve the increased fee schedule. For the immunization fee schedule, the Finance Committee recommended that be approved as well. For the Hillsdale parking lot, the Finance Committee recommended that the full board approve the bid of RDK asphalt for the replacement of the parking lot. For the environmental health software, the Finance Committee recommended that we approve the purchase of Hedgerow, or the Hedgehog software with the company of Hedgerow, with the understanding that everything was included in the contract, including the training. Then they recommended also on the Three Rivers building exterior project that we move forward with the contract with R. Johnson Builders, and they recommended for Sturgis expansion that we set the date to provide details on work that is done, that they provide us with bills, and we could contribute up to $10,000 to the build-out cost of that space. And lastly, they did request that, or they did recommend that the full board move forward with the opioid funding proposal, sending that out.
Thank you, Teresa.
Yes. Thank you. Moving forward, the Program Policy and Appeals Committee meeting until March 15th, and Commissioner Matthew chair of that, I'm gonna turn it over to you for a report on that at this time.
Thank you, Mr. Chairman. Page 34 in our package. The report is there as you have already read. Page 34, Mr. Chairman.
Yeah. And so we have those minutes, we have been accepting those minutes at this meeting, so I will entertain a motion to accept the minutes from the Program Policy and Appeals Committee meeting.
So moved.
Motion by Commissioner Hoffmaster, second by Commissioner Lanius to accept the minutes of the Program Policy and Appeals Committee meeting. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All opposed, motion carries. New business, AAA Advisory Committee appointments. And I believe these were reviewed at the Program Policy and Appeals Committee meeting. We have in our packet the list of, what,
7.
7 individuals.
I make a motion, we approve the individuals recommended.
I second, Mr. Chairman, for Trish Wood, Amy Duff, Pamela Riley, Michelle Locke, Kelly Younger, Madeline Whitcomb, and Denise Brees for that positions.
Been properly moved and seconded to accept the recommended names for appointment to the Area Agency on Aging Advisory Committee. Motion by Commissioner Hoffmaster, second by Commissioner Matthews. Is there any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Personnel policy updates. Starting on page 45 of our packet today was the outline changes of the personnel policy for the agency. This item again was discussed at the Program Policy and Appeals Committee meeting, and it came forward with a recommendation for approval by the full board. Is there a motion to accept the
Make a motion to accept the updated personal policy as stated.
Support.
motion by Commissioner Baker, supported by Commissioner Hoffmaster, to accept the changes to the personnel policy as presented? Is there any further questions or discussion on the personnel policy? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Next item on our agenda is the immunization fee schedule. That is on page,
If I may, Commissioner Lander, plan of organization, I believe is next.
thank you, ma'am. I stand corrected. I'm getting older, you know, my eyesight's not as good.
There's a lot of stuff on this.
Yeah,
agenda.
there's a lot. There's a lot.
What page is that on?
It starts at 104.
It was a colorful page, Mr. Chairman.
Yes, page 104, we have a resolution presented before us to adopt the plan of organization for the health agency. I have spent the last week reviewing several hundreds of pages on the agency website that go along with this plan of organization.
Thank you.
Yeah.
Again, this item was discussed at the Program Policy and Appeals Committee, and it came forward with a recommendation for approval by the full board. So the floor is open for motion to approve the resolution.
So moved.
I second.
Motion by Commissioner Hoffmaster, second by Commissioner Matthew, to adopt the resolution for the Branch Hillsdale St. Joseph Community Health Agency plan of organization. Yes, because this is a resolution, we shall vote. Is there any further discussion? Hearing none, we will do a roll call vote.
Commissioner Matthew,
Yes.
Commissioner Counts is absent, Commissioner Hoffmaster,
Yes.
Commissioner Leininger,
Yes,
Commissioner Baker,
Yes.
Commissioner Lanius.
Yes.
Thank you.
that would be 5 yes, 0 no, and 1 absent. Motion carries. Now, immunization fee schedule.
Page 117.
All right, thank you.
You're welcome.
And we heard a little bit ago that this was discussed at the finance committee this morning. They recommended that we adopt the fee schedule as presented, so I will entertain a motion to accept the updated immunization fee schedule as proposed.
So moved.
Support.
Motion by Commissioner Lanius, supported by Commissioner Hoffmaster to accept the immunization fee schedule as proposed. Do we have any questions or discussion on this? Commissioner
Thank you, Mr. Chairman. We discussed I have one clarification on page 117, that $23 administrative fee, that is for single vaccination, or what happened to a person who comes in, he or she needs 3 vaccinations, but administrative fee is only one time
Is per vaccine,
per vaccine,
or per shot.
per shot.
Yeah,
Isn't
some
that
shots
a-
have multiple vaccines in them, right?
Yes, there are combination vaccines.
So, Mr. Chairman, I have concern that, I have addressed this last year too, I believe. So, my family, we have quite a few children and grandchildren. If they come here, just say I got 5 shots, I am over 60, like somebody mentioned earlier, whatever category, I don't know. But, so we have to I have to work another job. $23 for 5 shots each. We are 6 or 7 people, so I have a real concern. Is it any way we can have administrative fee for one time? If a patient comes in, we want to encourage our citizens to come here, this office. That remind me to ask how many people came last year. You don't have to answer now, Mr. Chairman. So I think it is $23 per administrative fee, very excessive. Again, I have the limited knowledge. I do not know how 83 counties or 38 or so the community health agencies working. I do not know. So I think $23 per shot, that is, with that we are saying, Mr. Chairman, we are saying don't come in here, go to your doctor, we are too busy.
Commissioner Baker.
What does the administration fee cover as
Yeah.
far as our fees? What does that cover? Is that needles and syringes? I mean, if that's the case, then it's a revolving fee that we have to have for each one.
It does cover all those things. It also covers some staff time. I guess what I would like to assure you though is that we do bill Medicaid or these other insurance companies, and the administration fee is picked up by them. So our VFC program, we don't charge them an administrative fee. If they're uninsured and they don't have insurance at all and they qualify, we're not charging them any fees, right?
I don't believe so. I don't recall off the top of my head.
So I'm hearing that they think I'm correct. You know, the whole purpose of the Vaccine for Children program, and we also have an adult program that's got 3 letters as well. The purpose of those programs is to fill that niche with those individuals who do have difficulty paying. And I'm thankful, Commissioner Matthew, that you are looking out for those individuals that are most vulnerable in our 3-county population. because we do not want them to not access services because they can't afford them. But that is why we do have the VFC and the adult program to allow them the opportunity to get these vaccines without cost. So it is federally funded, and our fees are covered in those programs.
Mr. Chairman.
Yes.
I appreciate our health officer's comment, grateful. However, that funds, as many of us who work in the insurance and various other social services, we know that money you have, the health officer mentioned, it is federally funded, government take care, insurance take care, it's all taxpayers' money. And we do have a paid staff, like Commissioner Baker mentioned, we have a staff here. I'm not only talking for us, I'm going to talk about, I serve on the Michigan Association of Counties Health Committee, Policy Committee. I will be addressing that there too. But we are a small, 3 counties here. We are not all billionaires, only few billionaires here. I am not. Okay, and so I think we should think about charging each shot $23 each. And it is like I go to a McDonald's, I'm saying each French fry I eat, I have to pay $5 each.
Yeah, I would just also offer that if you go to your private doctor, you're paying an office visit fee. We don't charge an office visit fee here. So, we're simply trying to recoup the cost to do business, so. And if the insurance pays us less than 23, we take it. I don't remember what Medicaid gives us.
$7 we get from Medicaid, but that's where your cost-based reimbursement dollars come in, right? We bill them all year long, 23, they pay us 7. And then at the end of the year, they look at the whole picture. How many shots did you give, or how many services did you provide? Because it's more than just immunization shots. What did it cost you to provide those services? And then they try to make us whole at the end of the year through Medicaid cost-based reimbursement dollars. So these funds are also used in the budget to make that program, so we don't have to put a lot of local dollars into
Right.
it to run that
You
program.
know, Commissioner Matthew, you bring up a point that, okay, these other programs are federally funded or state funded taxpayer dollars. Well, the health agency is also funded with local appropriation dollars. If we reduce that administration fee to 1 fee per client based on how many, and they get how many of our immunizations for that, that client that is an insurance pay client, we're gonna receive less reimbursement from the insurance company, which is then going to mean that we now have to increase the appropriation figure to our local counties to offset that cost. Not that I wanna pay higher insurance rates because of that, but at the end of the day, we're going to pay for it, whether it's from that fee for service to the insurance company, or that increased local appropriations to each local county.
I guess my takeaway from was it, if you're poor and you can't afford it, you still get the shot and you don't pay the $23 anyway.
That's right.
So basically, this fee is a fee that we're trying to recoup some of our funds from the insurance companies, Medicaid, so on and so forth. And if you can't pay it, you don't pay it anyway. So I'm not sure where we're headed with this.
I agree. We have a motion on the floor to accept the fee schedule. Is there any further discussion? Hearing none, we will do a roll call vote.
Commissioner Matthew,
Yes.
Commissioner Hoffmaster,
Yes.
Commissioner Leininger,
Yes.
Commissioner Baker,
Yes.
Commissioner Lanius.
Yes.
Thank you.
Motion passes 5-0. Commissioner Hoffmaster has to leave us at this time, so thank you.
Sherry, sorry. Thanks, guys. I appreciate it.
Thanks for your time.
Yeah, take care.
Moving forward, we have the environmental health software proposal.
Actually, it's
We have the fee schedule.
It's the
The
fee schedule.
environmental health fee schedule. Goodness.
I put these
If I-
little checks next to each
If
one.
I would look at my packet, I would see that it's the environmental health fee
Hey,
schedule.
Brett, you need to borrow my glasses?
I put these little checks when we're done with one, and just move on.
I'm telling you, it's from processed milk.
The environmental health fee schedule, and Paul talked about this a little bit in his presentation earlier. I know the finance committee looked at this earlier today, and recommended that the full board approve the fee schedule changes as presented. I will entertain a motion to accept the fee schedule changes as proposed.
So moved. Second.
Motion by Commissioner Lanius, second by Commissioner Baker to accept the environmental health fee schedules as proposed for the Branch Hillsdale St. Joseph Community Health Agency. Are there any questions? I guess the one thing, when would this be effective? Immediately or the next fiscal year?
We're looking at April 1st.
Okay, so that would be, accept the proposed fee schedule effective April 1.
Now, to get this straight, we're just passing on the fees for, like, recouping the mileage. It's not changing what you guys are getting paid for your mileage, it's passing those on? Okay.
Yes, I mean, the health agency, we pay the federal mileage rate, I guess.
Which is variable based on what it is that month, or, correct?
Well, generally, the IRS sets the federal mileage
For the
rate for the year.
Sometimes they make changes, but not all.
There's been 2 times, I think, in the last 20 years where they have changed that federal mileage reimbursement rate mid-year. 1 time was last year. Any additional questions or discussion? Hearing none, all those in favor of the environmental health fee schedule say aye.
Aye.
All those opposed, motion carries.
Now we do software.
Yes. Now we're on to the environmental health software proposal. And this, again, was discussed at the Finance Committee this morning, and we heard that they recommend the acceptance of this recommendation from the agency staff. So I'll entertain a motion to accept the purchase of the environmental health software.
Recommend a motion to purchase the environmental health software.
Second.
Motion by Commissioner Baker, second by Commissioner Lanius to accept the proposal from the Environmental Health Department for the purchase of the Hedgerow Environmental Health Software for Branch Hillsdale St. Joseph Community Health Agency. Any further discussion? Yes, Commissioner.
Mr. Chairman, we have discussed at the Finance Committee meeting this morning that the health officer and the director of finance require that contract presented before us and make sure all the lines are closed, also for very detailed. And we commended that our distinguished commissioners from Hillsdale County and also from the St. Joseph County to look at, they are very expert on that. That's my understanding. I can be wrong.
I just want to clarify, normally the board takes action and the health officer signs contracts. Are we still intending that for this project? I wasn't sure based on what you were
What
mentioning.
I was attempt to say was, please make sure that contract is at an opportunities, at least 2 members of our members to look at, because they are technically savvy.
Okay.
And we are not taking your leadership or anything, just we want to make sure it is done properly before we sign.
Has that contract been reviewed by our legal counsel?
We haven't got a contract yet. we are
Okay.
coming to you to ask for us to be able to, you know, enter into contract based on the information that's
Yeah,
provided
based on
in
the
this
bid.
proposal, yes.
Couple of questions I had, and I know, you know, when we buy computer software, sometimes we get a beta version. Well, that's Microsoft all the time. But, the program that you have now, I think, I read, you bought that 4 years ago.
Yeah, a little over 4 years ago.
And it sounds like it's been a problem since. Was that a similar system where we had an ongoing contractual fee that we paid on that, or not?
As far as the contract goes, yeah, it was a continuous contract, yes. And they actually, because we were having so many problems, we called meeting with the CEO a couple of times, and he actually gave us some money back a couple of times because they knew they weren't providing what they were supposed to be providing. And that was the biggest hiccup, that what was promised when we signed up with them was never delivered.
What was the cost of that software back then, and what was our annual?
The cost was $15,000 a year. I don't know what the onboarding was. I don't have
Okay.
those numbers.
But that annual cost was $15,000 a year.
Correct.
Just checking that.
So the annual ongoing cost for this new program is gonna be $49,200 a year.
Correct.
Plus 6,000. I believe.
The $6,000 that's mentioned in there is a one-time.
Yeah, that's once the final thing is done, there's a $6,000 payment, as I read that.
Did we own the last software, or was it a licensing agreement
It's
also?
a licensing agreement.
That's,
We should have cut the cord long ago. We've allowed ourselves to try and continue to work with this company, probably because we thought the price was right. And we've never gotten what we paid for 4.5 years. We have a product that does not work. We've never been able to onboard the well and septic program into this product. We attempted, we had about a month and a half in, and pulled the plug and went back to the way we've been doing it before that. The food program, kind of limps along, but it doesn't work right. We have, you know, even as simple as the reminder to inspect XYZ restaurant at this date, because they're due, doesn't even work reliably.
that's probably.
We have accepted a shoddy product for too long, and we need to move on.
I think I saw some of your requirements for the bid required them to provide testimonials from other agencies that use this, and you said that they're already in Michigan. What other agencies in Michigan are using this?
They're, oh, man, I'm gonna have to think
So
about this.
Calhoun,
Calhoun.
Mid-Michigan,
Yes,
Kalamazoo is coming on, I think.
Kalamazoo is
Kent
coming on.
County, there's more,
Yeah,
but
there's a number of them. And I've spoken to some of the EH directors at the counties that are using it. They're very satisfied with it. I know Becky has spoken to the health officers at a number of agencies too, and they are all very impressed with it. Talked with a staff member, well actually, we had a staff member that just left us, who went back to Mid-Michigan, that used the program and loved it too. So we haven't heard anything negative about Hedgerow. And talking with people that in Michigan that are currently still using HealthSpace, they are currently searching for new software as well. And it's just not working for anybody. It wasn't that it just wasn't working for us. It wasn't that they couldn't accommodate us. Their whole program is just not doing what it's supposed to do.
Have you guys been able to demo this somewhere, a dry run or something with it, and you're happy with everything that works and all the functions it has?
they have done a demo for us,
Yes,
and the staff was very pleased with what they saw.
yes,
Right.
everybody overwhelmingly satisfied with
I
the
mean, it's a
product.
big chunk, and it's gonna be a giant step to get this all implemented. Would it be worth maybe some key people going to one of these counties and just sitting down before we make this jump and saying, hey, let's make sure, I mean, obviously it's time constricted because of the things we got going on, but maybe they can make sure this is everything we want before we make a jump with this kind of expenditure before, I mean, that's up to you, it's your department, I'm just,
I really feel like we've done that already.
okay.
We've talked to the people that are using it. I have heard on more than one occasion, this is the product that you need to have. And, environmental health is a bit of a niche, right? It's local health department, it's a local health department thing. So in Michigan, we have 44 local health departments that have to do this type of business. This is not a software that every company is out there trying to do because the market is small.
And I'm sure it's different state by state, so
And it's different state by state. And one of the nice things about Hedgerow is that this product was built out for Michigan. So they have built out the food program to meet our Michigan standard. And they have built out the well and septic program to be what Michigan is known for. So in Michigan, we don't have one environmental health code for well and septic. It's every jurisdiction has their own, but we all tend to be very similar because of accreditation. So they've built out these programs so that they meet what we do here in Michigan. There's not gonna be changes to the software product. They're written, they're tried, they're tested. So this is the product we need. It's expensive, I agree.
Yeah, 'cause the
But-
cost to purchase the first year is $53,000,
Right,
and then the ongoing annual cost is $49,200.
yep.
I mean, it sounds expensive, and in today's world, it's really, the cost of doing business is really not that. I just wanna make sure it's everything you want before we jump onto this, and then 3 years later, we're like, man, this isn't what we wanted either.
I'm not gonna allow that to happen this
Okay.
time. So no, we are not going down that road again.
So you will have a
Teresa, you
performance
agree?
clause.
We will have performance clause. If that's what we need to have to make you guys, yes, we will have that. It's already in the proposal as far as the dates, by which they need to produce. But if you would like additional language, we will have it added.
And when we went through the RFP process 5 years ago, we wanted this product. We felt like it was the best product out there, but we didn't have the funding to pay for it at that time. And part of that problem was they gave us an incorrect proposal. Their proposal that they submitted to us was not accurate in what the dollars would be. They had extra fees in there that were quite frankly wrong, which made it way out of our budget. Or we would have picked this product 4 years ago.
And HealthSpace sold us a book, they sold us on a product that didn't work right from the get-go. They said they had a product that was built, ready to go. We were actually one of the first health departments to go on this new cloud-based version. And they told us it was ready to go and it was just gonna be great. They sold us on a product that it wasn't ready.
Well, I myself appreciate the fact that you guys tried to get the less expensive route from the beginning before jumping right onto the one that you really wanted.
So will this program be tablet and phone capable so that your on-site inspectors can complete that pre-filled inspection report on a tablet or phone and not have to do it on paper and then come back and do it again?
No, they can do everything from the field.
Perfect.
In defense of this program here, right now they're pouring money down a rat hole with what they've got now.
Mm-hmm.
Essentially, that's what's going on. You're just putting money in a rat hole.
Yep.
Okay. Software can make or break you, one way or another, in this business. And I'm not a professional in this business, but I do know that in business, software can make or break you. If you have the correct software, it can take an enormous burden off the workforce, which comes back to either maybe not hiring someone else or hiring someone else. If you can't pick up the slack with the poor software, then someone else has to come in and help in one position or another. So having the right software may prevent additional employees down the road. And with,
Well,
and with the ability to do it on site, even streamlines it more.
It sounded to me like we maybe just lost an employee that had come to the agency, went back to their previous employer. Don't know if it was because of frustration with the software program that they were having to deal with, but if.
I don't believe that was it, Brett, but, I know he was happy to go back to the other software system when he left.
Are you trying to sell us or not?
Yeah.
Well,
Didn't hurt his feelings at all, that he's gonna get rid of health space.
It is,
Can we
but
vote
I'm
on this?
business too, you know what?
We have a motion on the floor, because of the dollar expenditure, I will ask for a roll call vote on the motion to accept the proposal for the Hedgerow Environmental Health Software.
Commissioner Matthew,
Yes.
Commissioner Leininger,
Yes.
Commissioner Baker,
Yes.
Commissioner Lee, yes.
yes.
Thank you.
Motion passes 4-0 with 2 absent. Three Rivers Building.
Can you have your personal assistant?
Three Rivers Building Exterior Proposal. This was presented to the
Finance.
Finance Committee again earlier today. We have a proposal from us, I do believe, that is on
123.
page,
And you also have this at your place. It was not part of the packet because it made the whole packet skew sideways in size. It was made,
I think the actual proposal starts on page 130 from
No.
our,
123.
Well, what we prepared for you is on 123. The
1/3 each
bids.
of the brass tacks.
Yeah, yes, thank you.
5863.
Yes.
so we have the proposal from R. Johnson Builders for the exterior renovation work to the Three Rivers office. Do we have a motion to accept the proposal for a cost of
58,000, Mr. Chairman, and 630.
$58,630?
You want me to make a motion?
Yes.
Yeah. Mr. Chairman, I make a motion to accept from the R. Johnson Builders of Sherwood, Michigan for our TR building exterior for $58,630.
Second.
Motion by Commissioner Matthews, second by Commissioner Baker to accept the proposal from R. Johnson Builders, Inc. for the amount of $58,630 for the exterior work to the Three Rivers building. Is there any further discussion? Hearing none, I will ask for a roll call vote on this as well.
Commissioner Matthew,
Yes.
Commissioner Leininger,
Yes,
Commissioner Baker,
Yes.
Commissioner Lee, yes.
Yes.
Thank you.
motion passes 4-0 with 2 absent. The next item is the Hillsdale parking lot proposal, and there were, started on page 135 of our packet. I know this was presented to the Finance Committee as well this morning. I do believe I heard the comment of the recommendation to accept the bid from RDK Asphalt and Seal Coating for the bid amount of $95,100 to mill and replace the 3 parking lot surfaces at the Hillsdale office. So I have a motion to accept that bid.
So moved.
Second.
Motion by Commissioner Lania, second by Commissioner Baker, to accept the bid from RDK Asphalt and Seal Coating to replace the 3 parking lot surfaces at the Hillsdale location. Is there any further discussion? I will say just one comment that I had looking at these in, for the health officer and the staff, is maybe when we go back to restriping these lots, we may want to be a little bit more cognitive of our handicap accessibility parking spots. I noticed that, I think on the, what's this, find there is lot 2, which is the larger lot on the north side of the building in Hillsdale. I think the 2 parking spots to the southwest are the ones that are handicap accessible. And most or a lot of handicap vans now have the door and ramp on the right-hand side, and that may not be the best accessibility striping of that lot, so we may need to consider adding another handicap accessible space, maybe on the, you know, yeah. But I'm not the parking lot expert, so.
Well, you're the expert in Hillsdale County, and that's in Hillsdale County, so whatever you want.
And I do believe that RDK was, for Commissioner Baker and Commissioner Lanius, we had looked at this a year, or last fall, but we just didn't get the bids in time. But I do believe that RDK was the lowest bidder at that point in time. But we had only bid 2 of the parking lots, not the 3rd one, so. Again, because we're expending funds, I will ask for a roll call vote on the motion to accept the RDK proposal for $95,100.
Commissioner Matthew?
Yes.
Commissioner Leininger?
Yes,
Commissioner Baker?
Yes.
Commissioner Lanius?
Yes.
Thank you.
motion passes 4-0 with 1 absent.
2 absent.
2 absent, excuse me. Next is the Sturgis facility, proposed expansion. And that was discussed at the Finance Committee meeting as well this morning.
Yep, so the Sturgis Clinic, we were approached about an expansion project back in 2019, brought forward a proposal in 2020 to the Board of Health at the March meeting, which was approved, and then nothing more happened. So the landlord has come back and said, we would like to remodel this space, give you that additional space. Would you be able to pick up some of the building costs for the build out? And that's what we're asking today, that you approve up to $10,000 towards the project to build out the expansion. We have been asked by the Finance Committee to only pay upon receipt of receipts.
We have a motion to accept the Finance Committee recommendation of paying up to $10,000 for the build-out of these additional 629 square feet at the Sturgis location.
Mr. Chairman,
Yes.
I make a motion to Sturgis Satellite Clinic Expansion Project for $10,000.
Support. Motion by Commissioner Matthews, second by Commissioner Lanius, to accept the proposal on the expansion to expend up to $10,000 upon confirmation of the expenses of the landlord for renovation to the Sturgis location. Is there any discussion?
Only to bring us the bills, write them a check, right? So it's itemized.
The question I would have, and I don't know as if this was, and I couldn't find anywhere where this had been outline. I do believe in 2020, when this was originally approved, was the property owner going to cover the entire cost of that build out?
In 2020, they were gonna cover the cost of the build out. So the increased, she is willing to accept the rent agreement that we accepted back in 2020 without increase, as outlined in your packet.
If we expend the $10,000.
She might do it even without the 10 grand, Commissioner, I'm not sure. But she did ask me to come to you and request for you to assist in the build out because it is common in commercial spaces for whoever is assuming that space to pay for the build out cost. And the build out cost is estimated to be between right around $35,000. That was the number that her builder provided to me.
Who is the owner of the building?
Nancy Phillips, and so what's the company name? I know there's what is it? Maple Crest, probably LLC or something.
And at times, the tenant pays the build out cost, at times the landlord pays the build out cost.
Right.
You know, those things are all negotiable. Generally if the landlord pays the build out cost, you're going to end up paying more rent, for that facility. So the fee schedule for rent that we have would continue. We're in the 22, 23, we're in year 6, so there's 4 years left on that. I'm just, $10,000 of additional cost, spread over that, 629 square feet for 4 more years. Is that, that's an added cost that we've got to look at into the cost to occupy that building. Is our lease up at the end of 2027?
It is, but it's renewable. It's a renewable lease. She likes us. She really has wanted to keep us present in Sturgis to provide WIC. She's had family members that have utilized our services, and they have found them to be very valuable. If you actually look at the rent rate, I think you'll find it to be low. We are kind of a charity case for her. She allows us to, occupy space that's available and provide those services because she believes in the work that we do.
But this is not a triple net lease, right?
I haven't looked at that lease in a bit, it's not triple net. We don't think so.
We don't pay any of the taxes on the building, but we do pay our own utilities.
No.
Some of them, but
So, just the phone line.
yeah, just like.
Phone line, but,
Which I don't consider that a utility anyway,
so the heat and the electricity are included.
Are included. Okay. We have a motion to accept the proposal to expend up to $10,000 on the renovation of the additional Sturgis space. Any further discussion?
Anymore with commercial leases, what I'm seeing going further and further, we're getting a pretty dang good deal because any maintenance that's done or any problems with roofing or anything like that anymore, it's tending to fall back on renters and heating and cooling products and stuff like that. It's coming back on the renters. If we can stay into a low rent lease and this is all it's gonna cost us, then we're doing all right.
All right. All those in favor, say aye.
Aye.
All those opposed, motion carries.
Do we need a roll call because of the $10,000 expenditure?
Up to you.
There were no,
Well, then it's all yes, it is a roll call.
there were no opposed, so
Perfect.
the next item, and Alex looks like he stepped out, but
Yep.
request for opioid funding. We have a proposal from the Health Education and Promotion Department, that will be then presenting to the counties if we approve this for funding from each county's opioid settlement funds, for the health department to put together a opioid proposal, so.
It's a prevention program, that we would have our health education and promotion department put together and then provide to our community.
And you've got this budgeted into the 24 fiscal year for the health agency. So this would be something that you would not be looking for contributions from the county from until after October 1.
That is what we budgeted for, was for October 1 of 24, or 23.
Commissioner Matthews.
I mentioned I believe I mentioned at our finance committee meeting, as a devil's advocate, we have to sell this to all the commissioners. That's about 15 plus or minus. So I don't know how we can sell, I mean, I am for it, for education, but like I said this morning, almost 70% goes into administration. Only 30% or something goes to real presentation. We have an employee who is already paid. If I am wrong, please correct me. We have all the equipment, we have everything. So I don't know how we present before all three counties to win their vote.
So the 70%, this grant would just simply pay only 0.27% of Josh's wage. The rest of his wages, that other 70% of his wages, is covered by other grants. So this is not, we're not saying that, we would only take 20% of it. If I'm misunderstanding, I'm sorry.
I think what Commissioner Matthews is getting at here is, so we're looking at a combined cost of $10,000.
Per county.
Per county. The salaries and fringe benefits, which do make up the lion's share
Right.
of this grant proposal, we're just over $20,000 with those two line items of that combined 30,000. Now, a good share of that, Commissioner Matthew, if we accept this, is going to be paying for Josh putting together that presentation that will then be used, in each of our counties, working to encourage reluctance to use opioids. Exactly what that presentation will be, if it'll be like the video presentation that they have for the vaping series, I don't know. That's outside of my specialty.
Weigh in, if I might. So the reason we need funding from the counties to do this work is, our grant dollars, they come to us with specific earmarks. We can only spend WIC money to do WIC. We can only spend food money to do food. We don't have any money or any grant that allows us to do that type of work right now, which is why we're asking the counties to provide us with money that we can do that type of work. If we don't get this money from the counties, then we can't do that work, or we have to use our local dollars for appropriations that we are already getting, they're already spoken for. So we just don't have money to do that type of work.
And they're talking about the opioid educational program.
I just don't see a better place to go with it other than community mental health and the health department with opioid. I mean, maybe the law enforcement, but.
Well, and I know in Hillsdale County, if we move this forward, we may need somebody to come and present, because I know substance use prevention disorder stuff is already doing some of that, and Commissioner Benzing is concerned that whatever the health department does doesn't already overlap something that's already being done by the SUD forgive me if I'm not getting the correct alphabet acronym, but yes.
And we would be happy to come to a commissioner meeting and provide a presentation and answer questions. Probably Alex and I will come together.
There's a possibility that what Commissioner Bensing is doing could be rolled into this program also. Maybe?
That
I mean, that would be something that could be discussed.
Alex does go to those meetings.
the Substance Use Disorder Coalition.
I mean, it's all going the same direction, right? So
We don't wanna overlap, for sure.
we don't wanna overlap, so maybe, you know, Alex can take what Commissioner Benzing's got going and they can work together maybe and go everybody the same direction.
But their funding, Substance Use Disorder Coalition, comes from a different source.
Right.
I mean, some of it is going to be coming from the opioid settlement as well. They'll receive some direct.
Which is all fine and dandy because their funding can be utilized for specific part of it, right? What we don't want is overlapping, right? That's what you said, you don't wanna overlap.
Right.
So if you work with Commissioner Benzing on that and understand where he's at and help to promote him, he can help promote you. And everybody's going the same direction. You use your money for what you need to use it for, and the other program uses their money for what they're using it for.
Right, we could pick up the ball where he left off, or vice versa,
Right,
and make a
right.
better program than what we
Right.
could just do singularly.
So as long as the left hand's knowing what the right hand's doing, everybody should be okay.
I'll reach out to Commissioner Benzing, see if we can,
I
Sit down with them,
think
have coffee.
that would be a really good thing to do.
Do we have a motion to accept the proposal from the Health Education and Promotion on to request the funding from the 3 counties for the opioid?
I make a motion, we, send the request up to the $10,000 per county for the opioid settlement fund.
Motion by Commissioner Baker, second by Commissioner Matthew. Is there any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried.
That's my favorite part.
We are done now with new business. That brings us to that other opportunity where the public has to address us. So the podium is open.
Good morning, almost good afternoon. Long meeting to sit through today. My name's Jennifer Wirtz. I came to you a couple months ago, and I also today would just like to give a prayer before I start over you and what you're doing in your places that you serve. Lord, I just pray that you would pour out your unfailing love on those who love you. Give justice to those with honest hearts. Don't let the proud trample over or the wicked push them around. Look, those who do evil have fallen, and they fall down and never to rise again. May these people be a voice for the people they represent. May they speak against the evil that's being pushed in our state and our nation. Amen. I want to talk to you today just about a couple things that I have of great concern as a resident of Branch County and within your area. I appreciated what you said, Ms. Burns, earlier, that your quote was, "They sold us on a product that didn't work." I think that could be said about a lot of things that have happened in the last couple years in our country and specifically in our community. I would encourage all of you, if you have not looked into dailyclout.io, there is an excellent article on there that was put out by Ed Dowd. Ed Dowd was a financial analyst for years for Wall Street companies, and he's been researching the CDC's own data following the requirements for vaccination. And he just released this week that starting in the summer and the fall of when mandates were made for vaccination, that there was a 61,000 excess death in millennials. That's people my age that died excessively in years prior to that. And the only change in 2021 was the mandates for vaccines. And I would like to see on the website, I've looked through the website and there's nothing that shows the mortality rate for those vaccinated versus unvaccinated. I don't know if that's possible to put on our local website, but I think that that would be, you wanna be transparent, there's a way to start being transparent. Secondly, if you followed at all what's happening to the county north of us, unless your head's in the sand, there's a huge ion battery that, production plant that's being proposed there. I ask that you get involved, that you go back to your local counties and board of commissioners, your townships, and speak out against this. I've done some research, I've listened to several of the reports that have been made there. There's huge risks with lithium environmental batteries, the environmental issues, not to mention the risk of fires and explosions. We don't want another East Palestine right next door to us, do we? We don't want rails that come through our communities that could cause excessive toxicity. I'm not sure what the state is thinking. In one sense, a few months ago, I'm arguing that a river not be transformed because of a temperature to protect trout, but we're willing to sacrifice people, lives.
Your time is up,
We
ma'am.
need your help. Thank you.
Any further public comment?
Do I get to use my 3 minutes from the first time?
No.
Okay.
Christmas is gonna be awful good.
Just cruel. Just cruel.
No birthday cards, nothing.
That's all right. Hearing no additional public comment, I will entertain a motion to adjourn.
I'll make that a motion to adjourn.
Support.
Motion by Commissioner Baker, second by Commissioner Lanius to adjourn. All those in favor say aye.
Aye.
All those opposed, motion carries.
Thank you, Mr.